All right, I'm here with Anna, who is on the Pharmacy Future Leaders
Are we
the
live?
Pharmacy Podcast. No, we're not live.
Okay, good.
So if you mess it up, you can do it again. So it's more spontaneous this way. We have to do CE, so we're forced to talk to the researchers, which is awesome because this paper wasn't there in 2009. So go, tell me.
All right, so during the course of my residency year, I've been researching kind of
It's okay, it makes it more authentic.
I've been kind of exploring the relationship between health and housing and trying to find a way to integrate a pharmacist into that sort of relationship. So housing is a very well-known social determinant of health, and a recent study by Kaiser showed that housing actually contributes twice as much to our general health and well-being than our health care does.
Oh, okay.
So really reinforcing the importance of stable housing for health outcomes. And so
Everybody wants to go to conclusion first, but you can start with your background if you want.
So, well, I don't have a conclusion yet.
Okay. Okay.
Stay tuned.
All right.
And so, as I said, health and housing, they kind of go hand in hand. And one of the studies I evaluated was looking at kind of medical bills contributing to foreclosures on homes.
Oh, okay.
And not only did that Tony, you shouldn't be videoing it. It stresses me out.
Just keep going.
So these medical bills contributing to the loss of a home, and then when a person loses their home, it adds to the health problems because people start to have difficulty getting their medications. They start having difficulty getting food, and that filters back into poor health.
And that's why Congress turned down in the House of House of Representatives turned down the new bill because putting 25 million people without insurance would lead to this cycle,
which would lead to bankruptcies, which would lead to loss of housing, which would lead to continued poor health outcomes. So the cycle, it goes hand in hand.
And these are the circles, the health and housing circles.
Yes.
Yeah.
So kind of the purpose of this is to evaluate a pilot project that was worked on last year.
Okay.
So a pharmacist at Kelley-Ross, a partnership was formed between three local agencies. So Kelley-Ross Pharmacy Group, Affordable Housing Organization Bellwether, and our area agency on aging, or Aging Disability Services, which provided the funding for this project. And housing organizations like Bellwether are beginning to get pressured to improve the health of their residents in an effort to keep them aging in place. Because keeping these seniors living in an affordable housing building without medication management assistance or visiting nurses or kind of all of these other supports is better for the system as a whole. It's less expensive.
I just did a presentation. They told me that only 5% are in retirement communities and 95% are at home. So we're really hitting the group they're staying in their homes. There's just no room.
Yes. So these housing organizations, like I said, they're being pressured to create these health outcomes, improve health outcomes for their residents, but they don't know how. They're housing organizations. They're they're good at making safe spaces for seniors to live, not necessarily places where they're improving their health or med management or what have you. So there's all these other things that come into it, and so why not bring a pharmacist to this place? Integrate a pharmacist into a housing organization to help them and support the pressure.
Out in West Des Moines, they actually put a clinic. They put a clinic in a retirement community that's open to everyone.
Yes.
So there's a trend.
Yeah. So my study specifically is evaluating the pilot that was implemented last year. And my research question is to look at housing organization data to see if individuals who are seen by a pharmacist in the home perform better on housing metrics. So to see if these individuals who are getting a med rec done, being followed, getting med education, disease state education, are having more on-time rent payments, fewer lease violations, and fewer eviction notices.
What are your preliminary results since you don't have a conclusion?
So our partners have been collecting this data, this housing data, but this is new. This is new for housing organizations, and so there's no database with our current partner. And they're working on pulling the manual files and entering it into a spreadsheet.
Okay.
So we're still on hold.
Okay.
But we do have the pharmacy
What's
data
your gut
that we
say?
collected. And I'm not really sure.
Really?
I'm not. I mean, I hope that we're
okay.
having an impact, but our study sample is very small.
Okay.
We had 16 patients involved in this initial study. And so if anything, this study has kind of helped inform the next one.
Okay.
There is nothing on this. In my lit search, there is nothing evaluating a similar model or even trying to spin it
makes the literature search a little easier.
Yes.
Previous research absent.
Yes. And so really trying to spin this into something that's important for housing organizations.
But this is my favorite though. This is my favorite. Why is the pharmacist coming to my home? And this isn't, we usually have the delivery person, so tell me a little bit about what those interactions are like, because Christine Demakilangan from the University of Youth Sciences, in more of a Christian outreach, has gone to the homes with physicians or medical students, other nursing students, to do blood pressures and to introduce them to find out who needs help.
Yes, so this is a question we get all the time.
Okay.
And it's a good question. Because this type of work by a pharmacist is rare. This is unusual. And when a patient, in order to gain entry into a building is also a challenge.
Okay.
So how do we get into this community where people aren't used to a pharmacist or maybe any healthcare provider coming into an apartment building, right?
It's been a while since house calls have been around. Yeah.
Yes. And so what we'll do is we'll work with the resident services coordinators within these buildings. Okay. And that person typically wears multiple hats. They help organize group education or events in these buildings. They also may help coordinate transportation or help people kind of with some financial problems they might be having. And so we will typically, to gain entry, we'll do some sort of a group education class. We do screenings or maybe immunizations, and then at that point of contact, we'll promote the one-on-one visits. And so we'll get that referral, and then Kelley-Ross has access to medical records, and so we will go work up the patient, and we'll see them the following month. And a one-on-one visit is anywhere from 30 minutes to an hour, and during that visit we'll do a med rec. So kind of what is the med
list? Is this included in the provider status that you guys just got in terms of billing and things like that?
We're getting there.
Okay.
Push pause. So we'll do a med rec to kind of figure out what is the patient actually doing, what are they supposed to be doing, what medications are they taking, currently taking, how are they interacting with their medications on a daily basis at home? What does that look like? How are they storing them? Are they using them safely? So there's a lot of reteaching that goes on, and education, inhaler TJ's techniques.
And you're taking a lot of weight off the caregivers, because the caregivers are doing it all right now.
Yeah.
Especially with the Alzheimer's push that's happening. And
So that's kind of the in-home gist, if you will. And you asked about provider status.
Yeah.
So right now, we just got our first, we're credentialed and contracted with 2 insurance plans. We submitted our first medical bill last week. We haven't had results yet, but we'll find out soon. And so kind of what are the next steps with this project, right? And so looking at kind of, do we want to take the approach of medical billing?
Yeah.
Do we want to do this on a patient-specific basis based on their coverage? Or do we want to try and spin the data that we collect from a study like this into justification for a housing organization to support an APHA, create a financially sustainable model between a pharmacy and a housing organization to provide
I know retention is a huge part of
housing.
Housing, so
absolutely.
Yeah. Okay. Well, thanks very much, Anna. You've given us much to look forward to. Second video coming up sometime soon.